Welcome, everybody. My name is Michael Collins. I'm a professor at the University of Wisconsin at the Center for Financial Security. And our session is about what works, specifically looking at the topic of emergency cash assistance in the pandemic. We see in the data lots of families who had liquidity shocks, who were struggling to make ends meet. And then we saw the rise of these cash assistance programs and other kinds of emergency aid to help people get through what we thought in the beginning was a short-term rough patch, but today we're starting to realize might be a longer-term issue. So the pandemic has really just made these issues that were always with us, that economically vulnerable families have always faced, just that much more acute. In many ways, all COVID has done is put a magnifying glass under the struggles that so many families have. And so today we're going to learn about some models to think about ways that cash assistance can really become part of the toolbox that we use to help build people's financial stability over time. So for about the next half an hour or so, we're going to have some Q&A with two key experts in the field. Jesús Gerena, who's the Chief Executive Officer of the Family Independence Initiative, or FII. FII is a real leader in this field, helping us think not only about financial capital, but also social capital and how we build them in low-income communities. He's the CEO of FII and has been in that role since 2017, and that time has really strengthened the programs. They're active nationally and really a leader on these issues. Their technology platform is called Up Together. I'm sure he'll talk more about that, but it's super exciting, and I'm really happy to have him with us today. And then Rachel Schneider is the founder and chief executive officer of Canary, which is a mission-driven enterprise contributing to the evolution of 21st century social safety net. So she'll talk more about her work as well, but you may also know her from her prior roles, including the Financial Diaries, which has been a very influential resource for so many of us who've studied family financial instability, and has been a real leader with the Financial Health Network as well. All right, so enough of me. I really want to turn it over to you all to start thinking about these issues together. So at first I want to talk about this issue of cash assistance, and really cash assistance goes back, that's how we helped each other out in the olden days. That's how our parents helped us out. That's how we helped our friends and family out. And so at the same time as it's so old, it's also really new. You know, we've moved to a system where it just makes sense to give people money and to help them get through. So we've seen a lot more interest in cash assistance, in unconditional cash assistance in recent years. So help us think a little bit about what has been the impact of the pandemic on this movement, and where do you see the future of cash assistance programs? And I'm going to start with Jesús.
Sure, yeah, Michael, that's right. And we've been in this space. FII has been around for 20 years and almost 20 years. And from the very beginning, it was recognizing people's own ability and the initiatives that were taken to improve their economic position and invest in that and drive towards that. And we've historically seen great impact as a result of it. But it was always hard to get people to not think about leading with a program to assist those who are struggling with poverty and putting the burden of a system challenge of disinvestment into the shoulders of those who are struggling in poverty. And what I think has happened for the last 7 months is that there's no way you can put, right, like those systemic barriers, that burden back on people, that people understand through a pandemic. It's really clear. The economic conditions have changed, as most of us have heard in the last week. 8 million people at a minimum have been added to an already growing 40 million Americans who are struggling in poverty. And we know by the time this is all over, it's going to be a lot larger. And so the quickest fix is to recognize that people have huge abilities and to invest in them. And I think a lot of the narrative that we've built, the false narrative, as well as negative stereotype about the abilities of the working poor, have been lifted as a result. And so we can recognize this moment. And my hope here too is that it lasts for a lot longer than what the pandemic lasts in that sense.
Great. Rachel, what's your take?
Yeah, I mean, I think the pandemic really answered the why question. Like, why would you give people cash? You'd give people cash because it's the fastest and the most straightforward, and it trusts them to know what their needs are. And in a moment of national emergency, it just seems obvious that that's the right choice, to give people more cash. So those why questions, where prior to the pandemic, we already had a great momentum around the idea of cash assistance with the rise of UBI as a real policy topic that's being discussed. But there were plenty of why questions that still felt central. Why would you do cash instead of these other things? The pandemic answers that for people, at least in the case of real trauma, real disaster. And so there is real momentum because it moves people onto the next phase of, okay, we've answered why, so now we should figure out when is it the right intervention and how do you do it best? And those are different kinds of questions that still need big answers. And I think that those how questions and when questions, or in what circumstances questions, I would answer by saying, we need to continue to expand cash assistance because of what you said, that the fragility of people's economic lives was here before the pandemic and is here afterwards, and even more strongly so. So we're going to continue to need to innovate around how do you give people what they most need. And then the other thing the pandemic did, it's not really the pandemic, but the deep outpouring of feeling about racial injustice also gives new legs to this conversation, because the main way that we all handle emergencies is to rely on friends and family. And in the context of white household wealth being 7 or 10 times more than Black and Latino household wealth, the claim that you could just rely on friends and family is just so obviously false. And I think gives really important credence to why you should be investing in communities by pushing more cash into those communities.
Yeah, great point too. It's not just the pandemic. It's, again, the pandemic has combined with the other events that are going on in American society today to make us really realize that we have to do more to make equity more accessible. So we started talking a little bit about the mechanism. So we're generally thinking that cash assistance is important. It's an important tool to have in our toolbox. So let's think a little bit about how we distribute it. So there's lots of different channels that cash assistance could be delivered. You each have very different approaches in terms of how you're thinking about delivering cash. And so, we could imagine fly a helicopter over a community and drop dollar bills. That's a method, but probably not the most efficient method. So, what are the channels that you've been thinking about, and why do you think that they're most effective? And Rachel, why don't we go ahead and start with you?
Yeah, I do like the helicopter distribution channel. We shouldn't give up on that. So what Canary does is we distribute cash assistance through the workplace. And so what we do is we partner with employers. An employer will seed a fund that is then available for employees to access in times of hardship. And then when employees experience some kind of a personal hardship or a natural disaster, they can come and apply for funds that they do not have to repay back at all. And many employers use funds like this, structures like this, to also fundraise among employees so that people can contribute in and help their fellow colleagues. And part of why I think this is such a critical channel and a reason in a good way to deliver this kind of help is that employers have a vested interest in a financially healthy workforce. And so they are motivated to continue providing resources. And the way I think we should think about emergency assistance is just one more piece of a robust financial wellness package, that a robust benefits package that a good high quality employer would deliver to its people. And it has benefits not only to the individuals who might need to access the grants, but a broader cultural benefit, because it makes it clearer that a community of people exists through this company and has each other's backs. And there are some tax advantages for employers if they're going to use a structure like this. And I see that as no different than, right? So employers can get some tax advantages and individuals can get some tax advantages if they get emergency assistance from their employer. And I see that as no different than the tax benefits of providing health insurance through the employer. It leads to an imperfect system, and we can talk later in the session about policy change that should happen here. But we need more employer benefits that deal with the real problems that people experience today. And I think that drives longevity in the workplace relationship, increased productivity, increased loyalty, and a just generally higher engagement and feeling of belonging.
So the employer channel is one important channel. So then Jesus, you have another approach. So tell us about what your work is.
Sure. Yeah. So we've been promoting a strength-based approach, which is centered on three key principles. One is recognizing that social relationships and that social capital, as Michael, you mentioned, the way that people are, whether it's lending monetary capital or support, that could translate to monetary capital. If somebody watches my kid, et cetera, it's really invaluable. Two is, as people are demonstrating initiative, to invest in that. And then three is choice, that those who are closest to the problem, have proximity to these challenges, should be seen as the experts and recognized as such and invested as such. And again, we have a track record of demonstrating the value of this approach when it comes to facing the issue of poverty and its symptoms. What we've done in the last 7 years is to take that experience and digitize it so that we have a tool with our Up Together platform that allows us to really implement and help others adopt this strength-based approach. And so for the member experience, for a family who is struggling in poverty, they're creating a profile, naming their goals, tracking them as if it was their Fitbit, so that they get a good assessment as to how to be able to take the next critical step towards those big goals that they have for themselves or for anybody inside of their household. For us, we're getting the aggregate of that data. They're connecting their bank accounts, so we get through an API, an app on our platform, we get direct bank data from their financial institutions and any other one that they link, as well as that self-reported data around education, health, community, et cetera. And then we transfer dollars or create opportunities for them to receive dollars as a result of that effort. And the platform allows us to disperse the the dollars either directly to their financial checking account or savings account. And for those who are unbanked or underbanked, they can choose to get a prepaid credit card, essentially, that is either electronic or physical, and to be able to receive those dollars. And from that second one, we're also getting the data. So there's a real ease in the way that we can connect and learn from the individuals about the strengths that they possess. They're also able to create groups, so they're building on their social capital and extending their network with a platform. And so the technology allows us, right, again, to complement what we know works, what is already happening on the ground, and catalyze it in a really strong effort. And so for fund partners, so this is philanthropy and government, they can easily park dollars, recognize the initiative that these folks are taking, and trust that they know and will continue to know best how to be able to move towards their goals, and deploy dollars via regions, zip codes, et cetera. So it's really pretty dynamic. And what I will recognize is that we've gotten it somewhat right. And what we know is that we're going to continue to get it right, both with our collaborators on the funding side, as well as our member side. They're giving us tons of feedback so that we can grow and expand on this work.
Great. So that platform, just because I don't want to fumble it, but it's Up Together. Is that the name? Up Together.
That's right.
Yep.
Org. Yeah.
Org.
Anybody can go visit to it. Uptogether.org. It's pretty easy for you to, even if you want to get on the wait list and sign up when we have the ability to open it up for anyone.
Yep. Great. So Rachel, can you talk a little bit about the mechanics? So we heard about the mechanics of how through the Up Together app, benefits or cash benefits are able to be distributed. How do you think about this flow of funds when you're talking about employees or clients that are part of the Canary platform?
Yeah.
And what barriers are you facing?
Yeah, it's similar in some ways, right? So an employer that deploys with Canary essentially works with our team to set up their white labeled Canary. We call our platform a grant circle. So we set up the grant circle for that employer, and then they communicate about it with their employees. They give us a list of who's eligible, essentially. So for ours is a closed platform, and you can only come and apply for a grant if you're on the eligibility list. But an employer then communicates with their staff about what this program is, what its benefits are, and then workers have the opportunity to then come to our platform and they log in and create an account. Once they have an account, they can either request funds or they can contribute funds. And one of the really powerful things here is to see the extent to which people contribute, right? So we have one person who's contributing a small amount every pay period and saying, my goal is to ultimately fund enough so that one of my colleagues can receive a grant. And there's, I think, a really powerful benefit there in terms of dignity, because this is not a program you come to only with your hand out. This is a program you participate in as both a donor and a recipient. So we can receive money either by payroll or through our website or through ACH. And then on the flip side, when we're making grants, right now we are using PayPal to push money to individuals. And that's working for us pretty well, because we're working with an employed population that even if they don't have a PayPal account, they can set one up. As over time, we'll add more options, we'll add direct deposit, we'll add other ways to receive the money. But so far, we haven't really been getting pushed from clients to do that. It doesn't seem urgent. That said, payments are a real challenge. Like, as this audience knows better than most, payments are expensive, they're slow, they're error prone. We definitely spend customer service time tracking down why a payment didn't go where it was supposed to go. And when you're talking about emergency funds in particular, we have a huge, huge objective about being fast. And payments are a barrier there.
Mm-hmm. Jesús, have you found similar issues on the payment side?
Yeah, so we sort of entered this year with a very sort of traditional look at and thinking about our work. And as everybody else is experiencing, we got thrown for a loop. But the good thing is that we had already made certain improvements on our platform. So on the back end, we're using Stripe, which is based here in the Bay Area. And they gave us an ability to scale on the payment side, as well as to do that prepaid card option. And as we launched our national fund, Give Together Now, to be able to respond to the pandemic and give one-time payments of $500, it definitely adding, I think, a month and a half in, given the prepaid card option, created a really ability for people to easier get some dollars. We're seeing about a 10 to 15% user rate there. And then on the direct deposit side, it's actually been working really well. We get a little bit of that lost payment, but it feels pretty stable at this time. And I'll knock on wood, because I'm sure that as I say that, I'm going to get a call after this and be like, that's not happening right now. And actually, I'll share a quick story. One of the cool things, because we did do a couple of double payments and learning. And the reason that we learned that was because one of those recipients called us and was like, hey, I got a double payment. I don't think I was supposed to. And so, right, like, again, when we think about the narrative that we built about people who are struggling, and even in a moment of emergency, like, she did the right thing. She called and she said, hey, and that's how we picked up. And they were like, oh, okay. So we got about a dozen of those overpayments, and we're able to pull them back. And so, yes, bumps and things happen, but I think we're at 80 million that we've deployed since March. And again, it hasn't been perfect, but those sort of bumps have, for the most part, minimized, and now we're finding new bumps in the way that we're learning from the families.
Yeah, that's great. So far we've really been talking about the cash itself, moving money, or providing relatively small amounts of money, but giving people financial help. What else needs to be the complement to the cash? I mean, whether it's it could be the online tools we talked about. It could be sort of coaching or counseling. But what are the other things that people who are facing these shocks to their finances might need to be able to emerge from whatever this event is with a higher level of financial health? So I'll open it up to either one of you.
I'll start, but I'm sure, I know FII provides a lot more than, in addition to cash transfers, and we have aspirations of doing so as well. So I am thrilled that we are integrating with Spring4. Spring4 offers qualified referrals, essentially, to thousands of resources that could be useful to somebody experiencing financial hardship. And we're integrating Spring4 into our platform as part of our participation in the Financial Solutions Lab's nonprofit FinTech exchange. So we're just ecstatic about that. It feels so satisfying to be part of the lab and the cohort of other organizations participating in the nonprofit FinTech exchange is just fantastic. So we're really excited about that. And I feel like I shouldn't even explain really what Spring4 is. Michael was part of founding Spring4 and designing it from the from the beginning. But we do think that's only the beginning. I mean, emergency cash assistance is most helpful if it's part of a portfolio of other interventions and other resources for people, right? Because otherwise, I mean, to think about it in the most negative way, otherwise we're going to get far too many applications for grants. And some of the people applying for grants would be equally or better served by a loan or a savings product or planning services or better health insurance. And we can't expect to solve all of those problems. So we're going to be most effective for employers who are interested in having a robust set of benefits, and we are a piece of that benefits package. And I think some of those we'll be able to provide access to through our platform. So in this case with Spring4, where if you're part of the Canary grant circle at the employer with whom we're going to deploy it, you'll access it through us. In other cases, I think it'll go the opposite direction, where there would be some other benefits provider who would add on our service. And we think both are going to work great.
Jesús, what about from the FII and the platform you use? What are other services aside from the financial support do you think are really critical?
Yeah, so, we are historically have never been a service or a program. We really do believe that folks and their communities hold a key, and as they travel along their journey of success, as they define it, having a small community of support that can grow and expand is critical. And I think to Rachel's last point, I would just amplify that point that the truth is there's not a cookie cutter solution here as we think about emergency and beyond. And so I would say it's critical for anyone who wants to, especially for those who are struggling and during this emergency, is to put on that inquisitive hat and ask and to learn and to lift and to, test small to be able to amplify big. And I think, to that end, as a whole, if we're not building a new social contract, if anything has taught us this year, is that we have ripped apart the safety net as it existed, and I would argue was built on a flawed foundation, as it really was around the negative stereotypes and often racist stereotypes of the working poor. And so as we think about what to build next and to support those individuals who are struggling, how are we thinking about that new contract? How are we investing in people's abilities and sharing in the way that they're building assets in their way? So to us, that becomes really critical, because one of the things that we have found over and over again is that people are hungry for that sort of dignity and recognition of their abilities, and to be able to have easier access to dollars. And, I could go on about it, but the last thing I would just say to that effect, though, is we have done such a poor job over the last 30 to 40 years in creating an easy way for people to access cheap, flexible capital in low-income communities. How are we going to change that? And that's just like one place to start.
That's a great segue, actually, to talk a little bit about policy. We also have some questions coming from the audience, so I want to get to them. But before we do that, what are the lessons that you think you've learned from the last year, or just in general from your work around cash assistance, that not only for federal policy, but also for state and local policy? What can we take away from this that, maybe we could start to use to change some of these systemic inequities that we think need to be addressed?
Yeah, a couple of things. So one is, we did a survey of about 120,000, 130,000 people who received dollars. We've gotten about a 15% response rate. 75% of the dollars went for basic needs such as utilities, food, housing, transportation. Half of those dollars went for utilities. And 26% of the folks used some of the funds on their extended family or friends, or 21% some of the funds for their community. And that shows is that this works, that this isn't rocket science, that when you put those resources and the ability of flexibility for people to think, and I often relate it back to what happens when an organization gets a huge unrestricted grant. We get creative. We think, not only can I do X, Y, and Z, but I can advance on Z and A, right? And it's exactly the same thinking, right? And Rachel can speak volumes on this from her work in the financial diaries. It just frees people for an ability to be creative in growing their financial position. And so I think for us is, again, looking at the policies that we've built. So we're doing a pilot here in Oakland, California, with the Mayors for Guaranteed Income through the mayor's office, Mayor Schaaf. And it's specifically targeting earned income tax credit or a child tax credit, because there's no way that the philanthropy dollars that we're using to seed that demonstration can support it at scale in the city of Oakland, let alone the state of California. But how are we lifting the evidence of that impact so that we can change policies that best support those who are 50 to 150, 200% of poverty, so that as they're showing initiative and mobility, they can sustain it. And critically, that is the difference between those who are cycling in this vicious cycle of coming in and out of poverty. And we know about over a 4-year period of time, minimally 3/4 of them are, versus those who are able to sustain that, like those in the upper tiers of society, because there's methods of investment. And I think that's a fundamental change that has to happen that could scale easily.
Mm-hmm. Great. Rachel, how about you? What are some policy lessons at various levels that we can think about?
So I was going to say something more mundane than what Jesús just said. Payments is a huge one. I mean, we just need real-time payments, and this is ridiculous. And it's going to take some kind of policy change to get us there, or some kind of policy push. I also think that there's, one of the things that was really notable to me about this work I've taken on is that, so as I go around the world talking about it, and I talk about cash transfers that are coming from a group to an individual, what everyone says to me is, oh, my church does that. Oh, my synagogue does that. Oh, did you know welfare used to do that before welfare reform? Oh, did you know that the United Way does it? Like, this is a ubiquitous activity. It's just administratively hard to manage. So a nonprofit leader and that I was talking about this with at some point said, cash assistance exists, but it takes a systems ninja to find it. And nobody who needs it is a systems ninja. And so there's a huge lesson here about administrative ease and flexibility and the ridiculous barriers we put up between people who need help and that help, that are intended to make us feel confident that the help is going to the right place, but often just add unnecessary friction and make it hard for people to get that help. And so we do ourselves a disservice, because instead of spending our time and effort helping people who need help, we spend our time and effort on a lot of paperwork. And so I think that's a huge learning around this work that we can lift up, because cash assistance, the reason everybody said that to me when I was walking around the world talking about this work is that it's a basic human instinct and happens informally all of the time, every day, in every institution that anyone is a part of. And the work that FII is doing, or that we're doing, is really formalizing an informal practice and trying to use that formalization of the practice as a way to get new cash into communities that otherwise didn't get it. And so as we formalize this very natural informal instinct, we have to not overburden it and kill it. That would be the mistake.
I love the metaphor of a systems ninja. That's going to be a great takeaway. And the idea of administrative burden and reducing administrative burden of whatever programs we put in place is really critical, and hopefully technology plays a key role there. Couple of audience questions. So one's for Rachel, and that's when you get requests through Canary, are they specific to people who are maybe affected by a natural illness, or maybe they have an illness, or is it just kind of, I'm short? What are the sort of boundaries around the issues that people come forward with?
Yeah, it depends on the employer program. So the IRS regs that make it particularly advantageous for employers to do emergency cash grants to individuals have different rules for if your program is just for natural disasters versus if it's for personal hardship. So we can manage both, and we're working with employers for the most part who are choosing to do personal hardship and natural disasters. And in that case, we develop an event list, if you will, right? A set of criteria that work for that employee population.
Great. And then Jesus, how do you think about the sequencing of services? So people maybe need cash assistance, but you want to actually hook them up with some other services as well. Do they need to do the other services before they can be eligible to receive the financial assistance, or is it a condition of getting the financial assistance?
No, so we trust and invest. We believe that your networks and your ability to sort of navigate through the things that you want to be connected to, you're one relationship away potentially, or maybe the right door is close by. You just need to look for it to be able to support yourself to get there. And struggling in poverty doesn't mean that you don't know how to manage your finances. I share all the time. My mom brought us from Puerto Rico to Massachusetts with $80 in her pocket, and we participated in the safety net, and she knew how to navigate what little resources we got better than most people. That wasn't her need. And I think going back to this cookie cutter, like it could be that I do need financial services, and it could be that Rachel doesn't. And so how do we account for that? If we then make, and to her point, burdening everybody through unnecessary administrative work, how do you account for people's own expertise and abilities, and then trusting and investing in them? And so we lead with that trust and invest first, and then let them tell you. And if you're curious on how to be able to support them, that's the easiest way to find out.
Great. So we just have a couple of minutes left, so I want to give you each a chance to chime in and just where you think this field is headed. What's next? And, are we able to really show that we're getting good return, for either socially or return in terms of the investors in your programs? So go ahead.
Yeah, I think we absolutely are, right? So FII has been collecting a huge amount of data since their inception, I believe. We are collecting also lots of data, although earlier stage. And, what the data really clearly shows is that there's an ROI on this investment, that people report things that seem small, like I had less financial stress now. But they also report, well, the lack of financial stress or the diminishment of my financial stress enabled me to figure out what my next steps were. So it's that opening of the mind that Jesús was talking about. We also see really concrete things, like I was able to focus more on my performance at work, or I was able to avoid late payments or fees. I was able to avoid taking on debt. I was able to manage whatever the emergency was that came up. And then somewhat regularly, we also hear these really dramatic stories of impact, right? So we had one person who we gave a grant to, who just, tells this incredibly powerful story about her financial stress hitting exactly at the worst time for her pregnancy. And the cash grant that she got that was funded by her employer is what she credits with enabling her to have a healthy baby, right? And putting food on the table for her kids and being able to pay her rent. And like these kinds of stories of impact, they're so powerful and so important. And to me, what that suggests is it's not necessarily that we have a hard case to make or really that much more to learn. This works and it's an important intervention, but we need to keep making the case, and we need to keep collecting data so we can get better and better at targeting cash assistance to the highest impact uses, right? To the biggest needs.
Great. Jesús, I know you had a amazing comment to make to close this session down, but
I was going to compliment Rachel, so yes, we're good.
And Rachel did a great job of telling a great story. So thank you both for your expertise, for your leadership in this field. This is an important area. Anybody who's out there listening to this, I hope you think a little bit about this idea of emergency assistance. You've got two great role models to look at and two great programs to look at. And so thanks for being with us today.
Thank you, guys.
Thank you.